Shock, one of the biggest, scariest illnesses that we can find ourselves with in the back country. You might be thinking, why are we learning about shock so late in our illnesses? Well, the issue is that shock is typically a result of something that we have already covered when things get severe enough. So, what is shock? Shock is when the body's vital organs, so be it the brain, the heart, the lungs, they're not getting enough oxygen. So, whether that's the fact that the body is not releasing enough CO2 to bring in oxygen, whether they're at high altitude and there's not enough oxygen and they start to get HAPE or HACE, and now the person is going into shock because of this other disorder. It could be any of these things. Any sort of serious internal injury, an allergic reaction, severe bleeding, dehydration, heart attack, any of these other conditions can lead to shock. Okay, so what are we looking for when we're looking at into shock? So some of the early stages. So someone's going to be very anxious, restless, maybe disoriented, or a lower level of consciousness, so LOC, right? Um, and so maybe they're no longer alert and awake, but so we're starting to see this deterioration of their consciousness. Typically, they're rapid and weak or otherwise irregular heartbeat. Remember, things aren't getting enough oxygen, so body parts and organs are starting to shut down. So we're also going to see rapid but shallow respiratory rate. Typically, the person is going to have pale, cool, clammy skin color. Temperature and moisture is going to go down. Pink and warm skin, temperature and moisture of shock was caused by an allergic reaction. So it's going to look different than if it's triggered by some sort of illness or other serious injury. Nausea and sometimes vomiting, dizziness, and thirst. So you might be thinking to yourself, Alex, these are a lot of the same symptoms that we've already been talking about are other signs and symptoms for some of these other disorders that you're talking about and some of these other illnesses or injuries. Yes, but start thinking to yourself, is something else causing shock? Is this stuff a result of something else? Were they not nauseous before, but now they are? Were they alert and awake before, but now they're not? Was their breathing, their heart rate, their respiratory rate fine and now it's not? And does this person have a major injury and we could be starting to have these signs and symptoms of shock? Okay, so this is where this one really requires your thinking cap. The later stages of shock, if we're not able to get things handled, is the level of consciousness is going to continue to deteriorate, and eventually the person will become unconscious. Okay, the heart rate and radial pulse grows increasingly rapid, weakens, and eventually disappears. So this is why we're tracking things over time. Okay. So how do you give care to a person in shock, right? The secondary symptom of something else. Well, we have to first be able to identify it. So this is why we're tracking people over time and monitoring their systems to see if things are getting worse. Are these people going into shock because of a pre-existing condition? Okay, so keep the person calm and reassured. Have the person lie down. Make sure they're in a comfortable position. Okay, so maybe their body can start helping take care of itself. Make sure that they have an open airway and they are breathing. Keep the person from getting chilled or overheated, depending on what we're dealing with, whether it's hypothermia or heat related shock. Um, do not give fluids to an unconscious person or to a person with a serious head or abdominal injury. Okay. If the person vomits, do not give fluids. If evacuation will be delayed more than 2 hours, give a conscious person small sips to drink every 5 minutes if tolerable without vomiting. The reason that we don't want these fluids to cause more vomiting. We don't want someone to become more severely dehydrated because we're trying to hydrate them. Okay, that's why we want to call for a rapid evacuation and get people medical treatment quickly. Okay, if shock is not treated, it absolutely can lead to death. This would be a very scary situation to find yourself in. Okay, options are very limited in the wilderness, so early recognition and catching it at mild or realizing that someone's symptoms are starting to get worse after hypothermia or after heat exhaustion, things like that, call for a rapid evac. It's way better to be safe than to have regret.